with the increased seizures episodes.
Okay. And mother is
Okay.
with her or she's alone?
Yes, mother is with her.
Okay. So should I start?
Yes.
Hello, good morning.
Good morning.
Yes, I am Wakar, one of a child doctor here. Am I speaking with Jamie and mom of Jamie?
Yes, doctor.
Okay, so how are you doing, Jamie?
Doctor, I'm well, but now I'm having more episodes of fits. So that's why I'm very much worried.
Oh,
And yes,
uh, so how are you, mom?
I'm fine.
Okay. So, Jamie, yes, I have received a letter from your GP doctor that you are suffering from a condition called the absence epilepsy. And nowadays, you have more frequent seizures, and you are on the drug medicine called ethosuximab. Is that right?
Yes, doctor.
Uh, So I will take ask some question from you and from your mother. So I will write down on the paper. Is it okay for you?
Yes, sure.
Okay, thank you. Sir. Yes, Jamie, will you please tell me more about your this increased frequency of your fits?
Yes, doctor, I was doing fine and I was taking my medications. But during the last 2 months, I am having more episodes of fits, and these are a bit different type from the first one. So I'm not sure that what is going on.
Oh, I'm sorry about that. Miss Jamie, will you please tell me before you start the fits or the seizure, what do you feel? What were you feeling before starting the seizure?
No, I didn't feel anything. Just I feel tiredness and then I have jerks.
Okay. So, do you feel any any thing like you can't see anything? Are you hearing any voice or anything in your ears?
No, doctor.
Okay. So there is nothing so that it provoke your fits, right?
No, I feel tiredness. So I think that this is causing my fits more.
Means after you some do some exercise or some strenuous work.
I used to sleep nowadays
Triggers.
late in, and that's why I have problem in the morning.
Okay. Okay. So, mom, have you ever noticed during when Jamie is having fits? Have you recorded it or have you observed it by yourself?
Yes, I had made a video of her, and I can
Oh, that's
show
great.
to you. Yes,
Okay. So, mom, what you feel when during she had fever?
she just wake up in the morning and get ready for the school, but we noticed that she got more clumsy. The
Hello?
shoulder or the arms. Can you hear me?
Yeah, now.
Yes, she's sometimes she had the jerkiness of the hand and the arm. Uh, so after some time it get better. So we are not known whether these are seizure fits or these are just the tiredness that is causing these.
Okay. Okay, so yes, no problem. We will just do some test and we will just take history and we'll see either it is severe or not. So, Jamie, do you aware of your fits when the fits start? Do you know that you are conscious at that time, or you don't know anything that what's going on?
No, I just feel tiredness.
Okay. So, mom, as you said that he's in jerky movement. So at that time, her eyes are goes up, or any rolling of the eyes.
No, sometimes the jerkiness of the face is also there, but there is no eye rolling.
Okay. So any salivation from her mouth,
No,
anything
not
comes
really.
out from the mouth? Uh,
Not really.
okay, good. She is she wet herself during fits?
Sorry?
Is she wet
No,
herself
no,
during
no,
fits?
no,
Like
no, no,
no.
no, no.
Uh, okay. So for how long this jerky movements goes on?
It lasts for only 1 minute or 1.5 minutes. Then she get better on its own.
Okay.
Sometimes
So
in our
how?
school, the problem is going on, and her teacher also had noticed these things.
Oh yes, it must be difficult time for you and Jamie as well. So,
Yes.
mom, how frequent these, as she said, that it's a more frequent as past.
Yes. Now, during the in a week, she had one episode almost,
Okay.
and in the last 2 months, she had almost 8 to 10 episodes.
Mhm. Okay. So after this, as you said, lasting for 1 minute. So after that, how do you feel? She feels sleepy, or she feels lazy, or anything else?
So she just complained of tiredness, and then she returned back to the work.
Okay. Jamie, after you episode has lost, so what do you feel yourself? As mom is saying, you feel tired. So what was your feeling at that time?
Yes, she is right.
Okay. Do you feel any headache, any dizziness?
Not really.
Do you feel any tummy pain?
No.
You feel the heart is racing at that time
Yes, I do feel.
after the fits, right?
No, no, during that episode, I feel more anxious and I feel that my heart beats fast. But when it
Mhm.
gets over, then all the things get normal.
Okay. So, Jamie, at what age first you started your fits? Do you remember?
Yes, I had this problem 5 years back when it was the first
Mhm.
time. I was in my school and I had steering episode. So my teacher was calling me, but I was not responding. Then she said that I am not interested in my study. But when these episodes occur frequently, then she uh, write a letter to my parents that there is something going on and I have to be checked up. So after the brain doctor have seen me and they did my brain tracing, and they said that I have seizure, which is absence type seizures. They started me on medication, and after that I have a control on my that episode.
Okay. Okay. So, Jenny, during this time now you have increased frequency of seizure. Do you take anything to terminate your seizures, or it will go by itself?
No, it go by itself because this is my first consultation for this
Mhm.
episode, so I don't know what is going on.
Okay, okay. So, Miss Jamie, do you have any other history of any operation when you were young, very young, childhood?
No, my mom didn't tell me anything about it.
Okay. And is mentioned that you are taking the drug for this seizure, etosuximide. How, what's the dose are you taking?
Sorry, what's the
How many times in a day you are taking this medication?
once a day, as per my
Once.
doctor.
Okay. Have you ever forget to take, like you are going to your friends or a school or anything? Have you ever forget to take this medication?
No, 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 doctor.
Okay. Okay. You are taking on regular basis.
Yes.
Okay. So, what about your school? How are you in your schools in education?
Now, recently, my grades are falling down, and I am
Oh.
having difficulty in concentration and completion of my task. That is also very worrisome. Before that, I was fine.
Mhm. So, do you think the reason is because of your current situation?
Yes, doctor, I think so. This is bothering me a lot.
Okay, okay. And as you said that you notice that whenever you are sleeping late, so will you please tell me why you sleep late? Is there any problem?
I'm now I used to attend some parties with my friend, and then I come back late. So it took some time to get settle all the things and to go to the bed. That's why.
Okay, okay. So, Miss Jamie, sorry, this is really a very personal question. Do you have any boyfriend?
No, doctor.
Okay. So, have you ever taken pills like to prevent the pregnancy?
No.
Okay. Okay. So, do you take some drinks or any other drugs?
Yes, I have tried twice.
Okay. So, do you smoke?
No, doctor.
Okay. So, what about the birth of Jamie? Was it quite normal?
Yes, my mom told there's nothing much problem in the past.
Okay. Is there any other medication are you taking for anything?
Please wait for a second.
9 मिनट हो गए हैं.
Yes, 9 मिनट हो गए, 11 मिनट हो गए.
Oh,
Okay,
okay.
sorry.
No problem. So, yes, Miss Jamie, are you having any surgery?
No, doctor.
Okay. Mom, Jam has had her jabs at time.
Yes.
Okay. So, what about her development when she was since her birth? Was it normal?
It is okay. Yes, doctor, it is okay.
Okay. So, at what age, Miss Jamie, you had periods?
2 years back I had started.
Okay. Okay. Good. And how many family members, siblings you have?
I have two brothers.
Are they fine?
Yes, they are fine. Hello,
Your
hello. There's some disruption. Hello, hello.
वकार भाई आपकी आवाज नहीं आ रही.
इरफान भाई की
आपकी
आवाज
आवाज
कम आ
नहीं
रही
आ
है.
रही. No, but we cannot hear anybody.
I think no one is speaking.
Yes, Jamie, do you have any problem with your peers at school or at siblings at home or parents?
No, I have very good relations.
Okay, good. Mom, are you working?
Yes.
And what about your husband? Is he working?
Yes, he is.
So, how are your financial expenses?
We are well established. We don't need any support.
Okay, that's great. Mom, does Jamie has any kind of allergy with any
No,
medication,
doc.
anything?
No, doc.
Okay, anything else, Miss Jamie, which I have not asked from you and you want to tell me?
Yes, Jamie's father also had the similar problem of fits. Like he also used to have the
Okay,
jerkiness. So time is up.
okay, okay, yes. So, yes, today I took a history from a 13-year-old girl, Jamie, along with her mother. She is known case of absence seizures, which she had been diagnosed at the age of 5 years. She was on the ethosuximide since then. And recent onset, just few months, she had increased frequency of her seizures, and which she is saying that which can cause the problem in her education and in her daily life. And she, as she mentioned, she is compliant with the medication. The other thing that she told in her history that she used to go to the parties that night, and usually she is sleeping at late night, and occasionally she also used some alcohol. And so, as she mentioned that her vision was very increased frequency is sometimes it's provoked by the extra when she sleep late night. So, and her past history is surgical and medical history is normal, and her birth history was as well also normal. Her father is also suffering from such kind of absence epilepsy, such kind of condition. And my impression that she is having absence epilepsy, which is recently aggravated by her routine change in the lifestyle.
Sorry, can you please repeat the last line? What is your
Yeah,
impression?
my impression that she's a known case of absence epilepsy. Well, she was well controlled, but recent onset it was increased frequency because of her change in her lifestyle.
Okay. So what do you think? These new episodes of seizures are of same pattern as of the absence? Are they explainable in absence type of seizures?
Actually, these seizures was having little bit different, and is also she had mentioned that it was not like same, and which is since last some time it has been changed. Now there are jerky movements of the different part of the limbs and sometimes the faces.
Yes, so these are the different from
Different,
her previous. Okay.
yes.
So what do you think? What type of seizure is it?
Yes, she's actually known case of absence epilepsy, and in absence epilepsy, it can be generalized epilepsies, and also she had it could be some other thing like focal seizure because she said she had a one limb movement sometimes and sometimes facial, so could be the focal seizures.
Okay, so do you think that this is focal seizure? Okay. So how would you manage this case?
Yes, this need to be evaluated the cause of recent change and need a multidisciplinary approach because if it is focal, so that it might need an EEG again, and she might need an MRI scan and other blood investigation to rule out the other secondary cause.
Okay. So would you refer her somewhere?
Yes, already she is following. Already she is known case of epilepsy, so she must had a follow up in uh, clinic. So multidisciplinary approach. But recently, I would like to do some investigation before referring her to other specialty.
Like what?
Yeah, I will discuss with the consultant, and then as he advised. But usually in this case, we will do the MRI and some baseline blood investigations.
Okay, so time is up.
Okay,
19, no, 2 minutes or
still
more.
three
2 minutes
minutes.
or more.
Okay.
Yes, 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 yes. So, okay. So what about the medicines? Would you continue with it or you add something?
Yes, if it is absent seizure and it is not responding with ethosuximide and she is unwell compliant on this medication, we can go for the second line medication, which is lamotrigine.
Okay, why not any other drug?
Actually, the other choice is sodium valproate, but as she is a young female, so the sodium valproate has a teratogenic effect, so that we will avoid to go for the sodium valproate.
Okay, so lamotrigine would control her absence seizure as well.
Yes, sure, it will.
Okay, and what about the other parts of the management?
Yes, she need a psychological support, and she needs. Is there any problem in the schooling? She needs a support for the education. She and also her family needs support for her condition, and we will advise her that not to go late night parties and avoid alcohol. It can increase her seizures and it can disturb her routine life. So she need multidisciplinary input.
Okay, that's good. Okay, time is up. Hmm.
Alhamdulillah.
Okay, so
Yes.
it's a good history uh, from the seizures point of view. Please wait for a second.
Okay, no problem.
So it is a good history, and overall you had covered all the aspects. Um, there are the certain things which need to be covered.
Mhm,
Like she was telling that she's having absence seizures since for the last 5 years.
mhm.
So
At the age of
it
five
start
years, right?
no, for the last 5 years.
Okay.
So it started from the age of 8 years. Then in the you took the description of the seizures, aura and the details, the post-ictal phases and associated features, triggers, everything that was fine. Then at this point in time that we can came to the conclusion that this type of seizure is different from the staring episode. So she is having something new. uh, we can ask over here vomiting. You asked about the headache, vomiting, as well as the tongue bite, and you also differentiate whether these are the true seizures or these are the pseudo seizures like thing in the history point of view. Then the other components are fine, well managed. It is a good point that you took the menstrual history as well. In the family history, it should be covered that is there any history of seizures or fits in any other member. Like I in the last time give a clue that father is having such episodes of the clumsiness. So your history was well covered. Friends, school, sleep, alcohol, everything was took. Then in the impression, it was a fair impression that she is having some epilepsy generalized. That is, it might be a breakthrough type of seizure due to the some stressors, or it is evolving into epilepsy syndrome. Basically, I made this case that the absent seizure case is evolving into a generalized epilepsy syndrome, juvenile myoclonic epilepsy. The
mhm.
new type of seizures, I give the description for that juvenile myoclonic epilepsy, plus there is a family history. Early morning seizures, clumsiness is there, tiredness is there, lack of sleep. These are the stressors and leading to the poor
Triggers.
school performance. Yes. So basically, this was the evolved into epilepsy syndrome. Regarding the labs, it was in the history. You should ask about that when the last EEG was done and when the last neurology follow-up was done,
MRI.
when the any MRI was done or not, and when the last change in the medication dosage was done, and the in the future labs you covered well that she need EEG and MRI, and I would discuss with my consultant. Then regarding the further management referral and you add a second line drug, that is good. And you covered it with the lamotrigine, that is okay. Lamotrigine, although in um, the common drug that covers the juvenile myoclonic and the absence, levetiracetam and the topamax was written.
Mm.
And
Capra.
yes, that is levetiracetam capra.
Yeah, yeah,
And
yeah.
hmm, uh, then multidisciplinary team was also covered well. Overall it was good, and there is no major flaw in it. So in the limited time, it was okay.
Okay, thank you. So, yes, Dr. Rifat, I missed actually the investigation. I did not ask. It was a major part I should have to ask. You are right. And the other thing I couldn't reach to this was about the diagnosis, whether
Diagnosis.
it could be the
Yes,
juvenile
yes, yes,
epilepsy.
yes,
Yes. So
yes.
this was also
Because
because I was. Mhm.
the new seizure description was different, and all the triggers,
From the
associated
previous one.
features, yes,
I
and
was
the
thinking
age.
JME. I was thinking,
Hmm,
but I don't know why I didn't ask you.
hmm. And the
Dr. Wakar, can I
family.
say something?
1 minute, 1 minute. Yes, Dr. Irfan. 1 minute, Irfan. Yes, Dr.
Yes,
Irfan.
sir. Yeah, well, it was good attempt, I must say. But slightly the feedback from my side would be very harsh. And actually, it is not a good history, truly speaking,
Mhm.
because
Mhm.
you didn't think of the what is the information being given. Because it was clear that she had a jerky moments, especially
Mhm.
morning time. So you should get alert. It is a age also, 12-year age. You should think of second diagnosis is a juvenile myoclonic epilepsy. And then the things which is new, you must have asked for the fever to rule out meningitis, any history of
Mhm.
trauma. Okay, she told already to you that she has a deterioration in the school performance, also associated with the this one myoclonic epilepsy. And thirdly,
Mhm.
you should have asked anything like throwing morning time, usually associated with this epilepsy. And then when we are doing epilepsy, the differential meningitis, number one. Number two is neurocognitive syndrome. Because she had one seizure as absent seizure. No, it is another seizure that she is having. So you should have asked any neurocognitive marker like this one, Cafido spots, SDF spots, like that. You should have asked. And history of trauma. So these are very mandatory when doing history for epilepsy, especially new seizure. So you need to exclude meningitis, number one. Number two, exclude the any tumor. This is very, very mandatory when we are asking for history.
Mhm.
Then you can say it is an history with good cover up points. This is very really honest
So yeah, so
feedback.
these
Nothing.
these uh, these
Not,
your feedback regarding trauma, fever, and neurocognitive syndrome.
yeah, yeah. This is mandatory. This is very
I
mandatory.
agreed on these
And
three things which should not be missed. But otherwise, regarding the
Ac-
history, it
Actually,
is
Dr. Vakar,
actually
I'm telling I'm
yes,
just let me
Dr. Rahel,
complete.
1 minute,
Let
1 minute,
me
Dr. Rahel,
Dr. Vakar,
yeah.
can I
Dr. Rahel,
Uh,
1 minute.
let me complete because she
Okay.
told she has a deterioration in the school performance. So you must have asked for the rule of tumor, brain tumor,
Yeah, that you told, no?
fever.
That you told about the trauma and tumor and fever and spots. Yeah. Other
Yeah,
anything
yeah.
else?
Really, I mean, when somebody says you that there's a problem, and sometime you should have asked something like that SSP also, regression in the milestone. You should because she told she is not good in the school performance, she's not doing well, she's She's very conscious. So you must have asked any regression in the milestone. So these are very mandatory
Okay.
questions.
Okay.
Yeah,
So
I'm sorry to say
four
like that, but
feedback from no, it's okay. So four feedbacks from your side that I missed about the trauma and the fever, any blood spot, and history of measles and regression of milestone. So the fever I did
yes,
not
boss,
ask,
this,
spots I did not ask, trauma I did not. I agreed with you, but development I asked actually it
yeah.
was normal, and past history of any
No,
medical
no,
illness
no, you
actually I
asked, no, no,
asked.
no, my dear Vaka,
Mhm,
regression in milestone,
mhm.
recent regression in
Because
milestone.
development is normal. If there is any regression, definitely
No,
there is,
no,
and the
you
regression
don't get my
usually at the
point.
age of
You don't.
5 years. Now, 13 years, what regression is
No,
SSPE? 13
that's
years,
why I'm
no.
asking you. She told you she has poor school performance. So next question would be,
Mhm.
you should say anything which is in the present and not present now.
The
That is,
poor
I'm
performance
telling
she
you,
told
this is
because
a.
of absence seizure diagnosed, seizures diagnosed because of this poor performance.
But
She told me.
she told that I'm worried about because I'm not good in school performance, and she's quite anxious.
Yeah, currently she had because of
Yeah,
same
yeah, she told like that.
increased frequency
Currently,
of
she was worried.
jerky
She told
movements.
I'm
She
worried
has a
about, but
problem.
currently
Yes.
I'm not doing good performance. So and then
Yeah,
third is
because
your
of her
neurocritis marker. You should have asked.
increased frequency of seizures. Yeah, that I agree with you.
Yes, boss.
That
This.
I agree with you. You all
Yeah,
for
boss.
3 points I agree. But the regarding the history, as you said, the history of the seizure is same. It is not, so I couldn't reach to the diagnosis. That is another thing. But history of the seizure, which you can't say that history
Uh-huh.
was not according to the epilepsy. History was quite
Because
good, but
because the thing is
the
that
only
this is a
thing is I
reflection. No, no,
couldn't reach the diagnosis. And
yeah,
the
because that
second
uh,
thing which I
when we
missed,
are,
which should not
my
be
dear
trauma, fever, and spots, and
doctor.
these
No, no,
things.
Dr.
Yes.
Vakar. I'm telling you, if you are not reaching diagnosis, it means something was missing in the points. So that didn't give you the alertness. You got my point? If you are not reaching
No.
diagnosis, it means you
Mhm.
haven't asked the points, which he will give you the clue. Oh, yeah, doc,
So
I must think of this thing.
no. In this case, if you say it's a juvenile myoclonic epilepsy, so
Yeah, it
what
is
else
quite clear.
question would you ask? What else question you will ask
First of
regarding
yeah,
juvenile
I must.
myoclonic epilepsy?
Yeah, this is the thing. First of all, she
Mhm.
told it occur in morning time. Number one,
Okay.
it
So
is
if she
jerky,
told me,
like
I
any
mentioned
like a
it.
electric shock. Yeah, electric shock like that. You should ask like that, and then you should have asked anything like throwing in the morning. Usually, it is associated with this thing because when they have this seizure, they used to throw the things having in the hand,
Mhm.
and then these are the things which come in the myoclonic epilepsy. And age is a more important factor. 12 years of age, this is more frequent at this age. That will give you full time. You will not go anywhere else. Then you have to exclude meningitis, blah blah blah, like that, like that. This is my comments. Whatever harsh are, but it is honest comment. I'm sorry to say that.
I think overall the case was good. Even you were not reaching the diagnosis, but the approach was fine. It was sound, like the labs, referral, drugs, the discussion with the consultation, general advice. This was
Actually, Dr. Rifat,
accurate.
sorry, actually I'm busy, I'm not listening. But the only one thing I think that was missing was systemic inquiry to reach the new event, why it's happening. Otherwise, Dr. Vakar took the
Yeah.
history of the events very well, like before the event, during the event, and after the event, what's are going on. There are four in everywhere. There are 3 or 4 questions which we should know for the pre-event and during event and after event. But then we should ask about the systemic inquiry because this is the new things are coming on. Any vomiting, any headache, any morning headache or morning vomiting, weakness of the body, hearing, vision. Like we should rule
Yeah,
out SOL can be there,
yeah, yeah.
meningitis and cephalitis can be there, or
Yeah,
any other new
this
things.
comment I told, because you
Any
cannot reach the
head
diagnosis
trauma,
after not
any
asking these things.
hospitalization. any skin spots
Because I
there.
am telling this thing because
Yeah, loss of
these
weight.
are passing fail criteria in the history. If you see the guideline for the epilepsy in the Royal College of this one, RCPCH, you see the history in the for the epilepsy. This is the main point you need to ask.
Yeah, I think his approach was nice, and he was like cool and going very calm and slowly. But the some of the things were like follow-up team development, and like this was a she was giving hint for the myoclonic. That some part were lacking. I think otherwise was good actually.
Yes,
Ah,
Dr.
yes,
Rohit.
Dr. Vakar cover completely. Really, that was very fine. Only systemic inquiry if it include, and even he was having time also. So it was a complete history, like pre-event, post-event, each and everything he explored.
Yeah.
I hope I will not get examiner like Irfan.
No, but I'm truth. I'm honest.
No,
I'm not
no,
diplomatic.
you are
No, no, really, I'm not
three.
diplomatic. I'm telling you.
No, no,
No,
it's not the
I'm
matter
telling
of
you. I'm
diplomatic.
giving you
It's
the.
you have
I
right.
given you the
Yeah.
100% any honest information that this need to be excluded. And any history of epilepsy, trauma, meningitis, SOL. These are mandatory and passing fail criteria. If you ask anybody other than anybody, any examiner, because I know
No,
these
no.
things. That's why I'm giving you.
I'm not saying it's not the matter of diplomatic and not diplomatic. The thing is, the thing which I missed, yes, you are right. These things I have missed.